Hi, my name is Aubrey Gray. I am the program manager for our Therapeutic Behavior Services program at LifeWorks, and I am a clinician, a clinical mental health therapist. So we work with kids from ages 0 to 21 in Sonoma County that have full scope Medi-Cal. They come in through the Sonoma County Behavioral Health Services. And then they basically go through a big assessment that says, hey, based on these symptoms and where they're functioning, they could really benefit from our in-home behavioral services. So we come in to work as a add-on service to therapy or case management, whatever is their primary service, to be in the home and work with the youth and the family to make changes and help them, be able to function better. The way that we like to speak about our our theoretical underpinning, because sometimes people get confused with like what TBS actually is and what it means, because it has both the word therapy and behavioral, is that it really is a focus on the behaviors with a therapeutic underpinning. So we use a lot of the principles of applied behavioral analysis, trauma-focused CBT, cognitive behavioral therapy. Nearly every client that we see is coming in with some form of trauma or attachment ruptures. So we definitely do a lot of training around trauma and attachment so that we can best support the family and then have that underneath the behavior modification that we're doing. We are like the more behavioral component of mental health services. So let's say a client is seeing someone in therapy for depression. They're having a hard time concentrating in school and focusing. Their grades are slipping. Maybe they don't know how to communicate to ask for help. The therapist is going to be working with the client individually to, help those symptoms in a different, probably more emotion-based way. And we are going to go into the home with the family to help them build the skills and build the structure so that the family can support them. And maybe it's a regular check-in time that says like, hey, it's time to do your homework. Do you need me to sit with you? And teaching the parents and the kid how to communicate with each other around their needs. So that's the communication would be the skill that we'd be working on in the home. It's a 7-month program. The first 30 days is the assessment period where the behavior coach and myself go into the home, and it's really getting to know the family and their needs, what they're looking for, collecting, historical data to understand what helped get them into the situation, what's keeping them in the situation. So we use all of that information as well as the assessment that is on the treatment plan to ask how often the problem behaviors are happening. And then we also look at strengths to see what areas are already being used that they can build upon. And then we identify the 3 main behavior areas. So that could look like communication, that could look like school attendance, that could look like aggression, hygiene, social skills. And we identify really specifically like how that shows up for the client, how often that's happening, and then what our goal is for 6 months in the future when we've closed the program. So the way that they're implemented is we do the entire program either in the home, in the community, in the school, wherever the behaviors are really showing up. So it's 2 times a week for 1 hour for those 7 months. And the reason why it's so important is that we really do see a big difference in how people present when they come into the office versus when we're actually in their home, in their environment, in the dynamics. We might walk in and the house is messy, and we see the way that they communicate over that mess as opposed to being told about that interaction when we are here in a more clinical environment. So we really get to see what's happening, and also we get to see things that maybe they wouldn't think to mention, that we get to look at through a clinical lens and go, okay, like, maybe this is another factor that's a part of the entire picture that we can use to help change the whole structure and the whole process. I think it's been 2 years now since we closed, and I still think about this family often. I was actually lucky enough that they came and chose to speak at one of our Night Under the Stars fundraisers that we did a few years ago. So I got to hear from her how much the experience helped them. But basically, it was a mom and daughter who, because of the way that they had been interacting, had just gotten further and further apart from each other. And so through working on their communication and figuring out the why these things were so important to each of them, why showing up on time, why answering a text was actually a more deep reflection of their bond and how they emotionally show up for each other through their actions. They were able to come closer, because at first they were very much like, this isn't going to work, we're too far apart, the damage is done. And then by the end of the 6 months, they were actually sitting in the same room and hanging out and having positive times, which sounds like a small thing, but for them was huge. So yeah, that one had a really big emotional impact on me for sure. The referrals that we get for TBS come in through the county, so we are always in contact with them. The way that the structure works is basically we're there in the home for the behavior stuff. They're there. Oftentimes they're also providing the therapy services, and then they're also there to provide any additional resources, but also work collaboratively with us. So if we're seeing in the home that this kid is really into art and we're trying to work on social skills, we might talk to their case manager and say oh, hey, have you heard of any art teen night groups or anything? And then they'll go, oh yeah, totally, there's this other one, we'll get them set up. So that's kind of how we work together to find whatever resources will help foster their growth and build on their strengths for sure. Yeah, if you have full scope Medi-Cal and you go to the Sonoma County Behavioral Health Access Team, they'll do an assessment to determine your TBS eligibility, and it's really based around hospitalizations and placement, because those really speak to the high level of needs that you have in accessing TBS, because it is a pretty intense program and it's kind of invasive to have somebody come into your home twice a week. So it's really those people that have a pretty high need and have been going through some really difficult times that we want to support. I think that because all of our clientele are full scope Medi-Cal, we are automatically getting in with people who really need us the most. As far as our demographics go, we definitely see a lot of the Latino population, so we're really proud to be able to serve the Latino population with Spanish-speaking behavior coaches in their own language. We think that's really important. And personally, as a Black person here in Sonoma County, I'm always really honored to be able to serve the Black community, because there's not many of us here. So whenever they're coming through our doors and I get to, especially if I get to serve them personally, like that is a huge honor. So, and we always are checking the demographics to make sure that where we are serving is proportional to the needs. Like we want to make sure that that is an accurate reflection of what's needed in the county. That's always a hard question. I think that, like, I mean, just a lot of experiences in my life kind of led me into this direction. I think that, you know, being a person of color and needing support from a person of color and not really having that, mental health wise, like, definitely was a big factor in pushing me in this direction. I find a lot of pride in being somebody who, just by being myself, like, can have an impact on a kid who just needs someone who represents a potential future for them. Like, they see something different, and I get to be in their home, be a part of their family, be a part of their like microculture in that moment. That is definitely a big, you know, motivator for me personally in getting into the mental health area. I think the most rewarding part is probably my team, because I'm not someone who like necessarily like sought out leadership or anything like that. I really wanted to, I was afraid of being taken too far away from the clinical work, and not being in like the mix enough, like not being actually with the clients. But it's actually been a very like satisfying, gratifying position to be in, to be able to like help my team provide the best services we can to those families. And I kind of get to touch in with all of the families. But yeah, I definitely couldn't do it without my team. They're amazing.